on today's episode of the Real Foodology podcast.
So the number one rule of medicine is what?
Do no harm. Yep.
We're not doing that at this point in time. So how do we prevent this from happening?
Hi, friends. Welcome back to another episode of the Real Foodology podcast. We're back with part 2 of my conversation with Dr. John Kim of Kim Wellness. This episode dives even deeper from mold and heavy metal detox to the latest autism announcement, optimal nutrition, and how true healing starts at the cellular level. If you haven't listened to part 1, go back and start there so you can catch the full story. Let's jump back in. As always, if you want to take a moment to rate and review, it really does help the show. It takes just a few seconds. You can do it in your Apple or Spotify app, and the support really means a lot. Thank you guys so much. Thank you for listening, and I hope you enjoy the show. Vimergy liquid vitamins. They're here to show us the real mouth of America, where we take billions of pills every day. For years, we've been told that pills mean fewer problems, but many are loaded with pesticides, preservatives, and fillers. No wonder we often feel worse. Fatigue one day, stress the next, restless nights after that. But thanks to Vimergy, there's another way. Vimergy is fast-absorbing liquid vitamins that are pure, potent, and made from timeless ingredients. There's no sugars, binders, or preservatives, just what your body needs to support immunity, energy, mood, and sleep. Some of their popular products are lemon balm, which is a calming herb that supports emotional balance, stress relief, and focus. They also have magnesium, which is essential for muscle relaxation, sleep, and overall nervous system health. Zinc is important for immune defense, skin health, and cellular repair. And of course, their organic B12, which is a customer favorite of theirs, for energy, mental clarity, and nervous system support. It's vegan friendly and fast absorbing. It's time to take charge of your health on your terms. Stop relying on pills and start saving yourself with Vimergy liquid vitamins. New customers can save 20% off their first order with code REALFoodology. Just visit Vimergy.com, that's VIMERGY.com, and use code REALFoodology at checkout. I will never forget this for the rest of my life. When I was in college, I was a junior in college. My mom came out to visit me and she was in my apartment and she wanted to make dinner for us. And when I pulled out my nonstick pans, she gasped at me in horror, saying, "I'm taking you shopping tomorrow and we are tossing out all these nonstick pans and I'm getting you stainless steel pans." This was in 2005. This was 20 years ago. My mom told me to toss my nonstick cookware. And the reason why is because they're loaded with forever chemicals, also known as PFAS. And this is why I switched to toxin-free cookware and I have never turned back. I love our place. They make high-performance, toxin-free cookware. Their products are made without forever chemicals like PFAS and PTFEs, so you can cook confidently without wondering what's in your pan, except for what you're cooking, of course. And they have a cookware set that will upgrade your kitchen in just one fell swoop. In fact, I wish that this was around in college because this is probably what we would have done. The set includes 2 multifunctional always pans and 2 perfect pots in mini and full sizes that replace a bulky, expensive stack of cookware with just 4 pieces that you can sear, saute, fry, bake, boil, roast, steam, and so much more. It also saves you $150 on the cookware set with the bundle and save option. They also have a non-toxic air fryer that I love. I tell everyone to buy it. I love everything they make, and it's all so beautiful and aesthetically pleasing. They make everything look like an art piece, and I love it so much. So stop cooking with toxic cookware and upgrade to Our Place today. Visit FromOurPlace.com/RealFoodology and use code RealFoodology for 10% off site-wide. Again, that's FromOurPlace.com/RealFoodology and use code RealFoodology for 10% off site-wide. With a 100-day risk-free trial, free shipping and returns, you can experience this game-changing cookware with zero risk. I'm taking a lot of supplements right now because I'm on a specific protocol to get rid of the glyphosate, the babesia, the mold. But I want to get off a lot of them, but I feel like there are a couple supplements that I'll probably always take. And one of them will probably be the Body Bio PC, just because of how it helps build the,
cellular resiliency and cellular health.
Exactly. And I think, and because of that and everything that you just explained, it helps with the glyphosate. It helps just get all of these toxins out of the body. And actually, if I'm not allowed to share this, then we'll just cut it out. So let me know if I'm not. But I shared a lot on my Instagram. So people that follow me have probably know what I'm talking about. They've seen this, but I periodically will share this chart on my Instagram and say, this was a patient of Body Bio that had, high heavy metals, high glyphosate, There was a bunch of different stuff on there. PFAS, BPA.
That was actually my client.
Okay, yes.
That's my client. And specifically, we end up having to utilize oral form of phospholipids. Right? And that was a 6-month process in clearing it out.
And they all went down after they were taking the body bio PC.
Right. And specifically, that test is coming from utilizing looking at how certain toxins end up having to cause something called the DNA adduct. And we know specifically that this test is called IGL. And as specific is able to know, and we know for sure from the lab testing, that these certain toxins that impacting cellular health, and specifically your DNA, is able to be cleared out based on these protocols of implementing body bio, PC, and balanced oil, and sodium butyrate. Right? Those are really impactful things. I don't think there's any other tests out there that's actually showing that kind of improvement in the cellular health in that aspect. Right? We could do all the toxin testing we want to. And also, another thing that the toxin testing wise, even though it's very good to test for, there's a limitation of it. The reason being is what you dump out in the urine is what you see. So why that's an important factor for me to discuss about is mold toxins specifically, those are lipophilic. And so they actually lodge in the fat tissues. So if you've been chronically being exposed to mold toxins, also heavy metals, for instance, you're not able to let those things go properly. So when you're doing urine mycotoxin testing initially, you may see the level to be very low, but then 3 months later, let's just say if you want to repeat that, because now you're opening up and solubilizing these toxins.
And getting them out.
You can see higher levels of this. And so oftentimes patients are like, why are my levels so high? Well, it is good to see a high level, but also the timing really matters in terms of when that's going to be. So why this is an important discussion for me to make is I like to address more the environment, nervous system, and cellular health first, and then really helping to see if testing is appropriate at that point in time is really important. That saves a lot of money for patients as well. And this is a part that I often don't like how functional medicine is being played at this point, right? It's all about ordering a bunch of labs, a bunch of supplements to take, and then it just doesn't end, right? At least have some kind of roadmap so this way your client that you're working with, and as patients out there, you're listening out there, at least you want to know where you're starting and where you're ending, right? That's the important part.
Yeah, absolutely. Yeah, and you don't want to just be chasing this stuff forever. I want to talk about something that has been really big in the news lately, and that's autism.
Oof.
And it's big for many reasons. One, of course, RFK announced the beginning of this year that by September they were going to say, they were going to announce their findings that they found so far about what they think causes autism. Now, there was a lot of pushback from people saying, oh, how is he going to come back and say that so quickly? He only has 9 months to do that. But I think you probably have a lot to say about this because we've known a lot of this stuff for a long time. It just has not come to the mainstream yet. And this is something that I have been really frustrated with because just let's take the Tylenol in connection with acetaminophen, which is Tylenol. Tylenol is just the brand name. But there has been a long-standing connection between acetaminophen and autism, and I'll let you explain why. But I knew about this like 5 years ago. I've referenced the studies before on my podcast, so we've known about this. But the problem is that our current medical system has been really bad about getting this type of information out to people. And then I found out that you've actually known about the connection for 20 years. So to me, it was no surprise that he was going to be able to come out and say, we know about a lot of these different connections with autism, but it's really unfortunate for the families that have been struggling and trying to look for answers, and maybe people that are just now starting their journey with someone that was diagnosed with autism. And it's really unfair to those families that we have not gotten this information out to them yet.
Yeah. It's a tough topic to discuss about. And specifically, this is my opinion, and there's nothing against RFK. I think that they end up having to cherry pick the data into what they want to talk about. So I just want to lay that out. And
there's a lot of pressure from big pharma too. Let's not forget about that. Yeah.
Correct. There's a lot of interplay in terms of the lobby groups as well and big pharma. And so I'm questioning there's a lot of stress getting involved in doing so. And I don't want to ever be in that kind of position to announce it nationally. And a lot of flack and the stress is getting involved. I mean, working in that environment stress to begin with, now you have to dart bullets, basically.
Yeah. I mean, literally at this point, but yeah.
So let's talk about the Tylenol piece and how that's into play. So Tylenol in itself, acetaminophen, why is such a widespread use? But secondly, why is it dangerous, right? Dangerous, quote unquote, could be, point that I like to at least put in a quote, is because if you, let's just say, overdose, and if you're looking at the statistic of some of the liver damage that goes on and having to visit ER, Tylenol's number one. It's not alcohol, it's actually Tylenol,
I
right?
know.
It's very easy to overdose because it's out there to begin with.
And it's over the counter, which, sorry to interrupt you, but I just read this. Apparently, whoever oversees the regulations of, or whoever decides what is going to be over the counter versus prescription actually came out later and said that they regret making it over the counter because of how much people are getting harmed by Tylenol, thinking that it's not dangerous at all.
Yeah. So it is quite dangerous. If you take more than 4,000 milligram or 4 grams of Tylenol within 24 hours, you end up having to cause irreversible liver damage, right? So in the context of ER medicine, for instance, if you're trying to reverse liver damage that's coming from Tylenol, that would end up having to specifically use N-acetylcysteine, right? That is a glutathione precursor to reverse these things. Why am I talking about this? Well, when you're taking Tylenol, it actually depletes glutathione. So how does that occur is Tylenol end up having to, at least acetaminophen, turns into a toxin metabolite called NAPQI, is NAPQI. And that in itself is very hepatotoxic as one, but also can endless end up having to deplete glutathione production at the same time. So when you're actually having glutathione depletion to begin with, now actually causing additional oxidative stress and damage in the cells, and it can be very much irreversible. And glutathione is necessary for not only for detox, but also helping with immune regulation, also hormone regulation, right? And at the same time, it actually helps to play into helping antioxidant production and multiple other pathways into doing that. But how did Tylenol end up to come into play is you have to kind of go back to the whole cannabis part. And how does cannabis end up to come into play is there's a component of the cannabis is extracted, and the particular toxin metabolite is what NAPQI is. And that's where they end up having to be impacting into creating that particular damaging. But when you're taking cannabis alone, it's not going to cause that problem. But when you isolate a particular compound from that cannabis, and that's what you end up having to create. And this is what Big Pharma does, right? They end up having to take a natural component of certain plant, for instance, they extract it out, and they end up using it. And there are good things out there, for instance, like digoxin, which is supposed to help to regulate arrhythmia. That's been extracted from a digitalis plant, right? Flower specifically, and it's very helpful. But when you're isolating a couple of things like that, it can be very dangerous when you're using it incorrectly. So how does it end up having to impact autism discussion? Well, I have to say that Tylenol does not specifically cause autism, but it's just one of the components that we have to look at, right? And I made a point, and back in 2008, I completed my training through Defeat Autism Now. There was a group of physicians and pharmacists and other practitioners getting involved to creating a safe haven for supporting autism spectrum families, but also helping creating trainings available for doctors to be out there, and especially pharmacists as well, to helping these ASD community by utilizing biomedical treatments. So specifically, back then, I ended up having to do a lot of sterile compounds. So we used to make methylcobalamin injections, for instance, and other injectables for kids to utilize, such as leucovorin injections. For instance, one of the things that they were discussing last week.
Oh, and yeah, that's the medication that they're seeing.
Folate.
Yeah.
So
the help kids,
Yes. And then other things in terms of utilizing oral suspension. So we used to make customized vitamins for kids with spectrum disorders. Another profound thing that we utilized was oxytocin nasal spray.
Interesting.
That in itself creates more of a bonding aspect that creates between the child who's dealing with autism as well as the parent. But namely, another thing that we utilize is to actually help create a safer haven and feeling more of a connection for the child, so it's where they are able to see the doctor and be better connected in terms of their care. So those are things that really help impacting that. And one of the things that helped me change that, how autism can be reversed, and I'm not saying that it's 100% reversible, but it can be reversed, because there was one scenario where I actually had a client whose grandfather came in to pick up the child's methylcobalamin injection. Methylcobalamin is a methylated B vitamin, right? It's an active form of it. And methylcobalamin actually not only help with the Krebs cycle and then also the ATP production, but specifically it helps to create glutathione and detox, right? One of the things impacting this child was that the child was nonverbal until he was using methylcobalamin injections. So the grandfather was willing to wait for the medication, and he says, and before he was leaving, this was the only thing that actually helped my grandson to talk. Right? So that in itself becomes a really impactful moment for a practitioner like myself, and looking at that and positive change that goes on, that autism spectrum can be reversible and helping that. And I've seen kids who were nonverbal, became verbal, and then now they're thriving, they went to college and having an adult life that are not depending on their parents. And this is a part that's really sad for a lot of the ASD families. Yes, it's painful to raise them, but at the end, when they become 18, you also have to claim a guardianship in doing that. So there's a lot of legal issue at the same time. Lastly, what are you going to do if the parents is not there? Who's going to take care of them? So there's a lot of stress involved getting there. And then the siblings are getting impacted because they're getting neglected in terms of their care because all that attention goes to the sibling who's dealing with ASD. So there's a lot of interplay that.
If you follow me on Instagram, you know how particular I am about skincare. In fact, I've only used the same products for about the last 6 years on my skin, and my skin has never been clearer. And you know how much I love ClearStem. Their hydrating barrier cleanser, it's called Gentle Clean, is the best face wash that I have ever used. I have kind of drier skin, and whenever I use their face wash, it gets all of my makeup off, but it doesn't leave your skin feeling dry and stripped. It somehow still leaves it feeling kind of dewy. They nailed it with this face wash. I cannot speak highly enough about it. And also their skin spray all day. It's their hydration mist. I'm just using this all day. I have one in my travel bag. I have one in my purse. I have one in my car. And I'm just using it all day to just maintain that nice dewy look. They have so many amazing products. I could go on for hours about everything that I love on their website. But if you're new to ClearStem, they are the first clinically effective skincare wellness routine formulated with 0 pore clogging ingredients ever. This is literally their clear pore promise. And they were formulated to not only target acne. So if you have acne prone skin, but it's also anti-aging at the same time. I have an entire episode with the founders of ClearStem. We go more into depth about how they created these products to not only target acne, but also target anti-aging. So you don't even have to have acne-prone skin in order to use these products, and they are amazing. I highly recommend going out and just checking out their whole website. If you want to try ClearStem, make sure you go to clearstem.com/realfoodology and use code realfoodology at checkout for 15% off your first order. That's CLEARSTEM.com/realfoodology and code realfoodology for 15% off. Discover the ClearStem difference because clear skin changes everything. 2 of the most powerful supplements for women's health are whey protein and creatine, and they're often misunderstood and seriously underrated. Studies show that women have about 70 to 80% lower natural creatine stores than men, which impacts muscle function, brain energy, and even mood. Puri Creatine Plus combines pure creatine monohydrate with taurine to support strength, performance, and cognitive health. It's especially beneficial for both pre- and postmenopausal women. Like everything Puri makes, each batch of Creatine Plus is third-party tested for over 200 harmful contaminants and clean certified by the Clean Label Project. You're not only getting clean, safe ingredients, the test results are published online for complete transparency. Just scan the QR code on every product to see your exact batch's results. I use the Creatine Plus in a couple different ways. One way is I will make a whey protein shake in the morning and I'll add in some fruit and some coconut milk and then a scoop of the Creatine Plus. Or I love making these protein yogurt bowls with coconut yogurt, the Creatine Plus, and whey protein. And then I add a little bit of either grain-free granola on top, maybe some fruit, and that's it. Puri checks all the boxes: purity, potency, and peace of mind. So feel the difference for yourself and go to puri.com/realfoodology and use the code realfoodology at checkout for 20% off. The code even works on their already discounted subscriptions, giving you almost a third off the regular price. Don't wait. Try Creatine Plus today. Clean, science-backed supplements that you can actually trust. So go to PUORI.com/realfoodology and use the code realfoodology. Not to mention, but there's for the for the very extreme cases, which are not that rare when we look at the diagnosis or how much are being diagnosed with the autism now. Many of them have to wear helmets now because they're self-harming. They bang their head against the wall. They stim, which is like they're flapping and they're doing other things. They can't control a lot of their bodily functions. And I think the most heartbreaking one is the nonverbal piece of it because they can't communicate with the outside world. I'm seeing online that a lot of parents are teaching them how to use a what do you call that? Just like a piece of paper, basically, that has like letters on it, and they're tapping on it, and that's how they're communicating. And there was a kid that his mom posted the video, and essentially he said, "I'm in a prison of hell." Like he was like, "I'm in
They would
hell."
express. They understand everything.
Yeah, because he's like, "I can't talk, I can't express anything except for putting my finger on these letters," and it's heartbreaking.
It's heartbreaking. But you just made a very good point in terms of the flapping in the hand and rocking motion. That's a sign of a gut inflammation in a child.
Interesting.
And gluten actually causes more of that inflammation.
Wow.
Gluten, for instance, it turns, as you know, it turns to glutathione. Actually has a similar property to morphine. It actually works on the morphine receptor. But when you see a morphine addict, for instance, I'm very basically putting this very simply, and there's a lot more explanation behind that. But when you see a morphine addict, for instance, that rocking motion that goes on constantly, it creates that issue. And then when you see a child who's dealing with ASD, there's a similar aspect that you're dealing with, right? And then the lashing out and the violence aspect, that there could be a mixture of pans and pandas at the same time. There's an interplay into other co-infections like Bartonella infection and mold toxicity, for instance, as well. So there's a lot of interplay of it. So I know I kind of digress, but going back into why Tylenol is such an important factor to discuss about is because when you are factoring the causation of autism spectrum, you can't just isolate one problem. And this is the part that I might get a lot of flack about from some of the other families who has children with ASD or other people who are quote unquote anti-vaxxers, that the vaccine ended up having to cause autism. There's a bit of truth into what they're saying as well. I'm not discounting it as well. I'm in that community and I understand this, right? But there's a whole lot of other things in terms of that kid's vulnerability. Number one is the mitochondrial health of the mother. The health of the mitochondria of the child is dictated based on the mitochondria of the mother itself. Mother end up having to pass on that mitochondrial DNA gene to the child, and that becomes more the focal point of how resilient, cellularly resilient, the child is going to be.
Yeah.
So if a mother is actually being exposed to different toxins, for instance, like mold or heavy metals and all the things that goes on, that becomes a very weak mitochondrial DNA the mother's actually passing on to. So you're creating a child who's
less resilient.
So that, and then now the child's born, and then there's all the series of vaccines that could come into play. That's number one, including Hep B, right? And then the other things that could be coming into play is exposure to different toxins, right? It could be exposure to EMF, blue light aspect that I talked about, the circadian effect as well. But the other thing is genetic polymorphism, right? If the child actually has an MTHFR gene issue, right, especially when the mother and the father actually having this particular gene issue, it creates a higher risk of this risk factor. I'm not saying that they're going to be having ASD, but they already are in a vulnerable state to begin with. And something's going to push it over. So I call it more the Humpty Dumpty effect. The Humpty Dumpty sitting on a wall and nothing's going on, even though it's shaky, it's fine. But if that one stressor come in and push him over, his shell complete cracks, right? And that's what an ASD child is basically it, right? It's just that one particular stressor end up having to create that mess and tip them over. So the main discussion is Tylenol is a discussion. Could be when you have a series of vaccine the child is getting and child is actually febrile, and the things that the pediatrician would recommend is Tylenol or Advil, or at least mixture of it. So when you're having Tylenol and the child's already having vulnerability with methylation, it's not up to create glutathione. The glutathione production in reserve is already low, right?
Yeah.
So that in itself can actually push the child over to that state. So the Tylenol didn't create the mess. It's already having a unshaky, at least shaky terrain to begin with, and it's just creating a bigger mess in that sense of that. Now, there's a lot more discussion that we could put into play. There's a sulfation having issues, right? And then methylation now, all the things that come into play, including is it interrelated to the whole infection component in terms of Lyme diseases and mold. There's a lot of things going on. I have a friend whose son is autistic, and she thinks that is because when she actually had him, they were living in a moldy house. So is that the main discussion? He also had a one shot of DTaP. Was that the pushing over? We don't know that, right? But all in all is that there are causations that can actually play, but there's no clear indication or 100% connection that these are the things that's going to cause it. So why such an important discussion to look at is in terms of when I said the Trump administration having to cherry pick the data, they did because there's other things going on. I think they need to discuss about everything instead of just key points in terms of the leucovorin, at least the folate discussion, and then just the Tylenol itself, right? They have to look at everything.
I think I actually don't know because I haven't talked to Bobby or anybody in that camp about this, but my assumption is that this is going to be an ongoing thing that they're going to slowly start releasing more stuff. Yeah,
absolutely. So I don't say, saying that I'm mad or anything, but it's just created much more controversy than anything, right? And then there are now medical doctors and my pharmacy colleagues as well saying that there's no clear data doing so. There are studies showing that there are causation of hormone dysregulation as well as other interplay in terms of childhood development issues. There are studies already doing that, but there's no strong data to state that this is 100% causation of causing autism or developmental issues. But still, if you have a data, you have to take precaution. So the number one rule of medicine is what? Do no harm.
Yep.
We're not doing that at this point in time, right? And just because saying that this patient didn't get affected doesn't mean that this other patient is not going to be affected because there's other interplays of genes, the mitochondrial health, exposure to different toxins, and all that. So those are all epigenetic outliers that we have to also discuss about. So there needs to be ongoing discussion of this. So how do we prevent this from happening? Right, this is the part. Now, this is the part that's really heartbreaking for me to watch a child who's been doing well, at least from the parent standpoint, that they've been progressed very well, and all of a sudden they went down. How do we prevent that? Is number one, has to start before the woman conceives. The conception pre-care is very, very important. So not just the woman in terms of looking at, I'll recommend doing a total tox panel. I'll do a stool sampling on a young woman. I would also recommend doing organic acid testing to see how well the mitochondria is functioning, right? And then nutritional panel testing as well to really looking at interplay of all these different things, but specifically men as well, right? If there is a interplay of their lifestyle issue that could also impact their nutrient they need. Specifically, there's been interplay of how zinc depletion has been interlinked to autism spectrum disorder, right? So there's a certain amount of data on that, but certain lifestyle, certain use of things like marijuana can actually affect DNA methylation in the sperm. And that in itself can, or at least there's no clear studies showing that it's causing autism, but if you already know within the cell studies saying that use of marijuana, for instance, can actually cause DNA methylation problem in the sperm, wouldn't be one of the focal points that we have to really clean up the lifestyle of a person?
I recently found out after doing some routine testing that I have mold, and we don't really know where it came from. We were going to test my house, but I'm moving, and so we didn't want to go through paying and doing all of that just to move out of the house anyways. And my doctor mentioned that one of the ways that I could be getting mold is through my coffee. Coffee beans, unfortunately, are notoriously moldy. And so if you are not drinking coffee where you know that they're actively testing for mold, there is a high chance that your coffee has mold. Trust me, I know I heard this for years and I rolled my eyes and I just didn't want to deal with it because I love my coffee, but I started taking it very seriously when I found out that I had mold. So I started drinking Everyday Dose. I love it. Everyday Dose is a functional coffee that undergoes third-party testing to ensure purity and potency, free from mold, and they're rich in active compounds. I love how functional it is. You get coffee plus a bunch of supplements, vitamins, minerals, and amino acids, and it's so easy to make. It takes literally 30 seconds, maybe a minute if you want to count in the fact that you have to wait for your water to boil. But I use a kettle, I boil the water, it's instant, ready to go. It's so easy to travel with. And then you get everything in one go. It has collagen peptides in there. So you're getting amino acids. It also has L-theanine, which is really great for calming down the nervous system and make sure that your coffee doesn't leave you jittery. It just actually leaves you super calm. And then they have 100% fruiting body mushroom extracts. There's chaga in there and lion's mane, lion's mane is great for cognitive function. They have 2 different varieties. They have the mild roast, which has 45 milligrams of caffeine. So also if you are on a journey where you're doing less caffeine, this would be a great option for you because it's 45 milligrams. And then they also have the medium roast, which is 90 milligrams of caffeine. And I have very exciting news. You can now find Everyday Dose in Target stores across the country. You can celebrate with a buy one, get one free deal. You just buy any 2 Everyday Dose products at a Target store near you, and they will pay you back for one. Or you can also visit everydaydose.com/realfoodologybogo for more details. Again, that's everydaydose.com/realfoodologybogo. Exactly. I love how Hector just had to leave right now. And I'm like, damn it. He knows all this, though. I talked to him about all of this.
Oh, yeah. Well, that was not that's not for him. Cut that out.
No, I just love to give him shit.
Yeah. But it's really important, right?
But it's the importance of making sure that not only mom is healthy, but also dad is healthy. And I think that is the part of the discussion that we are not having on a national level yet. We're having it in these small circles of, functional integrative doctors, people like myself, and you're seeing it all over Instagram now. It's like, okay, before you conceive, you got to make sure that dad is healthy and also mom is healthy because this is all going to play in. I mean, I've been on this detox protocol for the last couple of months because I really would like to get pregnant, and I'm trying to clean up my cells and my body and my mitochondria as much as possible because I would love to have a very healthy baby and avoid any of this if I can. And I think my thoughts, I actually did a video about this recently. These are my thoughts, and I've based these thoughts off of talking to people like yourself and other experts in the field. I think eventually what we will find with autism is that what's happening is it's that there's the conversation we have a lot about the toxin overload, where you have a bucket and you just keep throwing more toxins in, and eventually it overflows. And I think what we're dealing with is a toxin overflowing right now, where mom's being exposed to all this stuff. She's unaware of it. We're not communicating this to the general public. She gets pregnant. Maybe dad has been exposed to a lot of stuff as well. And then baby is born, has super low resiliency. And it's pretty much all that you've already said. But, then you add in the vaccines that have formaldehyde and aluminum and all this other stuff. And then maybe you took Tylenol while you were pregnant and depleted the glutathiones, and then the baby isn't able to release all the toxins because the glutathione is really low, because we know glutathione helps the liver process and get toxins out. And it's the exposures of all these things. And I think it's just the compounding effect of all the exposures that we're getting exposed to living in this modern life.
Absolutely. And then you also have to looking at if a woman actually used birth control pills back in the day.
Oh, that too.
Right. So I'm not saying that all birth control pills causing autism, but what I want to at least address, I talked about the nutritional part.
Yeah.
But lifestyle really matters, right? In terms of what you've been exposed to, what you use specifically really matters as well. So why birth control pill, right? You have number of young women getting to take birth control pill as if it's some kind of acceptable lifestyle they need to take. I'm not bashing on people who need to take it, right? That's not the point. But at least know what issue you could actually have taking birth control pills. Birth control pills specifically cause nutritional depletion, drug-induced nutritional depletion, specifically CoQ10, magnesium, vitamin D, manganese, B vitamins, specifically B6, B12, right? All those things that you need for homocysteine cycling, methylation, that's already depleted. End up having to also deplete folate, which is also needed for healthy pregnancy, right? So you already have a folate deficiency to begin with. Now you're actually trying to have a child. That's another issue in terms of possibility connection. No one knows that yet. I'm just like hypothesizing, so don't quote me on that, but that's just one of the key things. So knowing that these are things that are going to impact that, then you really need to see how to optimize their health. So this is where proper lab testing is so important. Taking organic acid testing, all that. Because there are also studies showing taking birth control pills impacting mitochondrial function.
Mm-hmm.
Specifically, it also reduces some of the vitamins like vitamin A, D, E, and K also being depleted at the same time.
Yeah.
Right? So these are all necessary cofactor of nutrients that you need for healthy hormone regulation, right? That's another thing. Thyroid function, neurotransmitters, and cellular resiliency. These are all part of the things that are being affected. And you're also seeing birth control pills, which have been given to younger female athletes, for instance, their athletic resiliency goes down, right? So how is that impacting to cellular health? Very poor, right? So this is really important parts to really discuss about. So taking a thorough history from a clinical standpoint is really important. Asking the right questions. Also, another thing that I would also recommend, and this is kind of offside of it, if you have gone through heavy amounts of trauma issues, probably a good idea to work on yourself for 1 or 2 years. See a therapist. I mean, that's something that really be impactful as well. And I didn't realize how impact of the particular part is impacted my health before, but now working with people dealing with hypersensitivity issues or dysautonomia, that plays a huge role. Not just about mold or toxins. It's really how dysregulated the nervous system becomes or became from trauma and generational issues that they'll be dealing with. So that's a really important discussion to really looking at.
You brought up the folic acid piece, which I think is also another thing that we will discover. It will come out in time that we really messed up when we started fortifying all of our grains with folic acid and replacing folate with folic acid in supplements. So folic acid is the synthetic form of vitamin B9, which is also known as folate. Well, folate is vitamin B9 naturally occurring, and we need to be taking folate. We keep hearing, take your folic acid, take your folic acid. I actually saw this influencer make a video this week, and it made me so mad because he cut something from Paul Saladino. And Paul Saladino said, when you're pregnant, do not take folic acid. And he cut it right there instead of letting Paul Saladino actually explain why he was saying that. And then he goes off on this tangent. He's like, this is so horrible. It's so harmful for women. They need folic acid, blah, 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 blah. Folic acid is the synthetic form of vitamin B9. What we need to be taking is folate, which is the natural form of vitamin B9, like I already said. And what he continued to say in his video, Paul Saladino, was don't take folic acid, take folate. Now, if you want to take it a step further, and we know that 60% of women in this country have something called the motherfucker gene, otherwise known as MTHFR, which is what I have.
Cut that out.
I love calling it that. But I actually have this MTHFR gene. And what happens is my body cannot synthesize folic acid and create folate. Now, we also know that in kids who have autism, they have lower levels of folate in the brain. Now, I'm wondering what's happening there is that maybe women are taking folic acid and the babies are not actually getting enough folate because they're not taking folate. And then you add on top of that, if a baby has MTHFR, they're not even able to synthesize folic acid into folate. So I'm sure that we're only going to be able to unravel that further and understand what's going on there too.
But why is folic acid so important? It's like help to indirectly help produce glutathione. So there's a whole thing called the methionine pathway. So when you have homocysteine, for instance, homocysteine gets recycled to methionine, and that pathway of recycling requires folate and B12. And that itself end up having to help create glutathione. Right? So that's the part that's often missed about. But that also gets affected from blue light exposure as well. There's been studies showing that. So that's why, like I mentioned about, we need to look at everything into the environmental factor in doing so. So that's another reason. Like I'm don't take this the wrong way, and listeners out there, if you're living in a city, right? For instance, if you're getting bombarded by all these different type of environmental toxins, I mentioned about the Wi-Fi and then EMF and blue light. If you pregnancy-wise, in order to be successful, you have to create a cellular safety, right? If you're bombarded by these stressors, that safety is not being created. And that's going to also affect not only about having a proper resiliency, having, pregnancy is one thing, but also affecting your hormone, your microbiome statuses, and as well as your methylation, which is very, very important for detox, but not also healthy pregnancy. So that's why, there's a part that you really have to create. So if you're living in a city, for instance, you have to be extra in terms of hard work to create a better cellular resiliency to create a better pregnancy.
Yeah.
Right. So that's the part that's often really not talked about. And, why is there such a high levels of infertility going on? Specifically, infertility issues within the higher echelon of educated people.
Yeah.
That's the part that I was kind of wondering. And I did some deep search, and there were some outliers in terms of the more educated folks end up having to have better resources to go and then looking at different resources and to be officially diagnosed, right? Including working in fertility. But that kind of goes into hand in terms of how that's possibly affecting ASD as well, right? Is it because of the overall impact of the environment they're getting involved in as a result? And because you're more likely to be accessible to different therapies and such and diagnosis, that the ASD aspect of it becomes much more mindful into looking at that and the statistic becomes higher. No one knows about that. So I'm kind of going tangency, but this important factor to be looking at. So going back to the whole folate discussion, yes, we have to looking at, is it due to the mother's depletion of it? So main discussion mentioned about birth control pills and other aspect of genetic polymorphism is a really important discussion to look at. But specifically, folic acid actually turns to a toxic metabolite, and it doesn't really work well in the body itself. So I don't really recommend it either. But in terms of a way to replenish the folic acid, folate safely. Folinic acid is safe.
Folinic acid?
Folinic acid,
yeah.
Right? Quadrifolate and methylfolate, those are the two other options they could get as well. So quadrifolate is a third generation folate, actually has longer levels of sustainable impact in the cells. They've seen that and have to do so. So newer levels of prenatal vitamins that you could buy nowadays, either prescription or non-prescription wise, actually contains quadrifolate than anything. There's only maybe one or two supplement companies actually using folinic acid, and Body Buy is one of them.
They have a prenatal?
No, they have B vitamins, but they specifically use folinic acid.
Got it.
Better absorb, and then better ways in terms of utilizing the body anyway. So,
well, and I was also just going to say this because I know people are probably wondering this, and I get asked this every time I talk about this: which prenatals do I take? And I recommend that actually contains what you want, which is folate. I really like Wenatal, and there's also Needed as well.
Yep.
And I think both of those are great options. Yeah, as far as getting the right prenatals.
Yeah, and also I think Knees has a supplement just for guys as well for sperm health.
Do. So does Wenatal actually. Yeah. Which is great. Both the men and the women should be on stuff. Like Hector and I are both on Wenatal right now. He takes the him and I take the her. As far as prenatals go, we've talked a lot about EMFs and blue light. Unless if you feel like there's something else that you really feel like you want people to understand as far as EMFs and blue light go, maybe the only thing I will say is because we know blue light is affecting us so much, there's a couple little tips and tricks that I do. First of all, with my phone, I've programmed it to where I can turn my phone, like I click it 3 times on the right and it will turn red at night. Sometimes I have to be honest, I don't even do that because I get so annoyed with the screen being red. It makes it kind of hard to see, but like I try to be mindful of that. You're also wearing glasses that help block the blue light. I have a couple of those. I have red glasses that I wear at night. Also, I think turning all your overhead lights off at night, like around 7, 8 p.m., I turn off all the overhead lights. And I have light bulbs in like our living room lamp, for example, and our bedside tables that are an amber color that they don't emit any blue light, and they actually help your body produce melatonin. And I've found that actually really helps in my sleep a lot. And then, of course, avoiding phones at night and stuff like that. Like I don't really watch TV after 8 p.m. I like to read at night.
Yeah. Huge impact on those. Other things that I like to also tell people is that you have something called a melanopsin, which is a photosensing receptor in the eyes. So you're able to, when you get an instant hit of sunlight in the morning, it will tell the body to recycle the melatonin, and then saying that this is and end up having to turn on metabolism and such. But the most impactful part is that melanopsin is also on your skin, right? So if you're getting exposed to blue light, for instance, your sense of skin end up having to impact that. That also ages your skin. So people who are infrared blue lights, for instance, for a long period of time, in terms of how that's affecting the antioxidant level within the skin is very, very poor. So I would recommend using some type of antioxidants and having to help create that. Certain peptides could be very helpful, but that's a whole different discussion. But that's another thing that I would recommend doing in terms of blocking out a blue light. I recommend at least 2 hours before you go to sleep. So generally, you should have a designated safe area in the house where you have red light bulbs And I would recommend not LED red light bulbs. I actually recommend getting incandescent red light bulbs. That's a really important thing.
So if somebody doesn't want a red light bulb, I'm genuinely asking this. I'm going to my Amazon account right now because I want to ask you about this specific. Oh no, I don't have Wi-Fi on this. Let me see if I can remember the brand. There's a brand that I buy that they market themselves as a blue light blocking brand that makes these light bulbs, and it's an amber color. And I have to tell you, personally, I don't like using the red light bulbs. I always tell Hector I feel like I'm in like a brothel, and it just like makes me feel gross. So what I do is I do the
Don't go to Amsterdam, people.
It just makes it feel to me, but I don't want to discourage people from doing it. But maybe if people feel similarly, from what I understand, if you do this amber light, which I find really sexy, like it reminds me of like what I would imagine like the old days where, it's like like it feels kind of like candlelight.
Right. It's warm and soothing. So you could get a regular incandescent light bulb that actually helps to create that wavelength, right? It's all about wavelength. And that's the part that's either stimulating or it could be very calming. And so if you buy a incandescent light bulb, that could be very helpful. And if you
those are the old school ones, right? That have the little coil in it that you see. Yeah.
So those are. Now there was some conspiracy theory of how they were trying to get rid of it, and then now I think
it wasn't even a conspiracy. They actually did. Biden signed, and I think it was an executive order that he signed.
All right. So now they reversed.
But they reversed it. Okay. That was actually one of the first things that Trump did when he got back into office. And I just laughed about it because I was like, I was in support of it, but I was like, of all the things that we're dealing with right now, that's like the first thing you choose to address, which was funny to me. But no, it was a real thing that they had written into law. They were by a certain year, they were going to outlaw them essentially from being sold. So,
but the entire industry, right, the lighting industry is based on LED yet, right? So if you look at LED light bulbs, and you could take your cell phone, people out there, if you want to test it out, you could take your iPhone, for instance, and then put it to slow motion, tape your LED light bulb and see what it does. It flickers multiple times. So if you're dealing with dysautonomia or hypersensitivity issues and nervous system dysregulation, anxiety issues and depression, it's going to create bigger mess with LED light bulbs. That's why I don't recommend LED light bulbs at all.
Yeah.
Many reasons why I would recommend getting incandescent light bulbs than anything. So you have a consistent flow of AC/DC. You have ways in terms of being much more therapeutic in that sense of that, right? So that's really important. And there are incandescent light bulbs you could buy as well. And that's what I did in my apartment. So like I said, you have to create a designated safe area, right? Sometimes it could be a little difficult to start out, but it's ways to really helping to create that 1% improvement in your environment to impacting positive levels of health. So that's why it's so important. Light has to work first. And I didn't realize how impactful that was until I started wearing these blue light blocking glasses. I noticed that my eyes are much softer, my nervous system is better regulated, I'm getting a bit better sleep. And then I'm resorting to looking at how your screens are impacting your health, all that. And I didn't realize how impactful that was in terms of detox. And that's why I always recommend all these processes to my clients who are dealing with mold issues. It's not just because looking fancy and biohacking. That's not it. That's why you do that. And the second thing is Bluetooth as well, right? There's so many things going on in terms of Bluetooth technology, in terms of wearables and such. In many cases, Bluetooth, which is a non-native EMF, that not only impacting your cellular health, I mentioned about this whole voltage ion, but also affects your metabolic health as well, right? So they're now seeing that EMF exposure decreases, at least to affecting insulin property. So that's going to impact in terms of how well you're able to keep your glucose level and such. And how to mitigate that? You could do it naturally. You don't have to buy anything else. You just have to ground. Go outside, get your feet right into the soil, and getting that negative ion channel, not ions getting into your body, and helps to mitigate that issue. And there are studies now showing that proper grounding helps to reduce glucose as well. You see a couple point differences. Yes, wild. The body is supposed to be connected, right? I didn't even realize, like I learned about last week, when you are walking in a forest, for instance, and you have a lot of green leaves, those green leaves end up having to reflect near infrared from the sun. The photoreceptors end up having to emit those light into you. right, from the leaves. So that in itself, why do we feel much more calm and rested when you go hiking? That's because of that. And that's a lot of interplay in terms of that. And that's why when I learned all about this in terms of circadian biology and all the aspects in terms of quantum biology, more and more looking back, I was actually shameful of how much supplements I was actually utilizing in clients, and really dialing into simplifying these things. And that's how I came up with the Encore method in terms of addressing and teaching my clients how to simplify their life at the end, how to create a resiliency so that you are self-sustainable and live a better, fulfilling life.
Yeah, I love that. I feel like that's a great place to end.
Yeah.
Yeah, it's perfect. Well, thank you so much for coming on. I was going to ask you one other question. What are 3 free things that you can do to start feeling better today? Because I know a lot of people get really overwhelmed when it comes to wellness and feel like they have to buy all these things and do all these things. But let's do it kind of rapid fire just so we can wrap this up.
Yeah, 3 things you could do that's not going to cost any money. Number 1, reset your circadian rhythm. Wake up based on when the sun is coming up. So there's an app that you could download, and it's free to download. And if you want to get a full version, you could pay for it, but it's called a My Circadian. It's going to tell you exactly what time the daybreak actually occurs. You want to go outside, get that first light of light emitting from the sun. That's the therapeutic blue light. And then able to see the sun rising. It's going to really help to reset some of the stress response, but also help to renew your cellular health. So it doesn't cost anything. Right? And that near infrared that's emitting from the sun itself is so therapeutic for you as well. So if you're dealing with mold issue, that's the first thing I tell people to do. Wake up when the sun is coming up, and then block out some of the unnecessary blue light as much as you can, and also maximize the sun exposure middle of the day to get vitamin D. It's not just about vitamin D, but multiple other chemical pathway that goes on in the body as well. You're not taking any supplements. It's all free. Right? Second thing I recommend, eat seasonal-based food, right? And specifically seasonal-based paleo diet. You don't buy everything locally based on the season, and then also get good quality protein that you're going to get. And I would recommend supporting regenerative farming or local farmers. That's number 2. Right. Number 3, optimize your sleep and your nervous system. That's the most therapeutic thing you could do. Right. If you're getting good sleep, if you have the better self-regulate yourself in your nervous system wise, 99% of the issues you're dealing with disappears.
Yeah, it's true. Okay, those are perfect. Well, please let everybody know where they can find you.
Yeah, absolutely. So you can find me on Instagram, john.farmd. I put a lot of content into cellular health and detox and how to support yourself better. And my website is kimwellness.co. You will see wealth information in terms of what I talk about, especially the Encore method. But if you want to book a call, there's a link right there that you could call. And I'm going to provide a special link for Courtney Swan's listeners. And we have a lot of resources that I'm going to put together for you.
Awesome. Thank you so much. And let me know what that link is and we can add it to the show notes too so that people can access it easier. Well, thank you so much for coming on today. I love the work that you're doing. And if anyone is struggling with anything that we talked about today, I would highly recommend reaching out to Dr. Kim. I've been working with him personally. Me and my husband both have for the last couple of months. And thank you so much for all the work that you've been doing in my own personal life. And you're doing a lot of amazing work in the world. And I just want to say thank you so much for everything that you do.
No, thank you. It's been an honor to be here. Thank you so much.
Thank you. Thank you so much for listening to the Real Foodology Podcast. This is a Wellness Loud production produced by Drake Peterson. Theme song is by Georgie. You can watch the full video version of this podcast inside the Spotify app or on YouTube. As always, you can leave us a voicemail by clicking the link in our bio. And if you like this episode, please rate and review on your podcast app. For more shows by my team, go to wellnessloud.com. See you next time. The content of this show is for educational and informational purposes only. It is not a substitute for individual medical and mental health advice and doesn't constitute a provider-patient relationship. I am a nutritionist, but I am not your nutritionist. As always, talk to your doctor or your health team first.